Welcome to the MediMobile podcast. In this episode, we're exploring how MediMobile partners with medical billing companies to supercharge productivity and drive innovation. We'll dive into how Genesis, our automated coding solution, tackles key challenges, strengthens client relationships, and gives billing companies a competitive edge with real-time automation. I'm Emily, here with MediMobile's Director of Business Development, Lauren Hall. If you're a billing company looking for smarter ways to work or better outcomes for your clients, this episode's for you. Let's get started. Lauren, how exactly does MediMobile partner with billing companies?
MediMobile partners with billing companies because it's such a logical fit. The charges are entered into MediMobile, or if customers are using Genesis, our autonomous coding solution, the CPT and diagnosis codes are automatically added to those charges, but they have to go somewhere to be billed out to insurance companies. And that's where our partnership with billing companies makes so much sense. We take the data that is being entered that we're receiving from hospital feeds and we send that over to the billing companies, which has really helped build the partnership that we have with so many of our great partners today.
Wonderful. So Lauren, what specific challenges do medical billing companies face that Genesis, our automated medical coding solution, is uniquely equipped to solve?
So I think we can all agree that time is a challenge for everybody in every piece of a healthcare workflow. So saving time is a very big, important concept for our billing companies. The other thing is their resources. We see billers and coders getting burnt out, leaving the profession completely. So what we can do with our partnership is we can decrease the amount of time that your very valuable billers and coders are spending on tedious tasks. So one thing, just very simply off the top, within charge review, we offer insurance mapping, where we'll take the actual insurance packages that are directly tied to a billing system, and we can have that mapping done within MediMobile. So your billers and coders no longer have to worry about the insurance package matching up in the billing system. We automatically do it for you within MediMobile. I hear constantly how much time that saves billers because of the insurance errors they often see within billing systems. So that's just one of the very simple ways that we save time for our billing and coding teams. Obviously, with Genesis, the autonomous coding solution that we have launched, that allows up to 75% of the time being spent coding to be redirected to other tasks for your billing and coding team. So that right there allows you to adjust your resources accordingly and maybe focus on tasks that have been previously ignored within the organization due to the time it takes coders to read through documents and code.
And so just kind of focusing back on our medical billing companies' clients, those clinicians, how does partnering with MediMobile help those medical billing companies improve their relationships with their clients?
So, having a trusted partnership definitely brings credibility to the table. So, when a billing company can say, we have this partnership that we see work with several of our other clients, it helps bring a sense of credibility to the organization itself. When we discuss our partnerships with potential customers, whether that be providers or large organizations, they rest assured because we already have a workflow down. We know the best practices. So, again, it just creates credibility on both sides, and it eases the minds of your providers or the organization with which you're working.
Exactly. So just kind of shifting back over to Genesis, what role does that real-time automation play in helping medical billing companies stay ahead of their competitors?
So AI is everywhere. We see that. But what's not everywhere is the accuracy that MediMobile has. We've spent years and years and years perfecting our autonomous coding. We also account for nuances for individual practices. So if there's a certain modifier that groups want added, or I always go back to our cases of critical care, those providers are moving fast. They need to get their documentation done. They need to get their billing done so they can move on and help that next critical case. So what we did was we actually worked with a group of critical care providers to come up with what we call smart phrases, because what we saw in their initial analysis is they were always under documenting the services that they were providing. And so when you have a discrepancy between what's being documented and the CPT and diagnosis codes that are being added to bills, it results in denials. You always want your providers to be reimbursed, or your organization to be reimbursed for the care that they're providing the patients. We also have to keep in mind the various compliance measures that are put in place regarding that care. You don't ever want to violate those. So with AI, we were able to put in place those smart phrases that allow those critical care providers to meet all requirements set forth in terms of billing and coding, but also it makes documenting just a little bit faster. And then they don't ever have to worry about creating CPT or diagnosis codes. We're going to do it for them based off of their documentation. So when working with billing companies, that story does come to mind, because not only are we saving the billing companies the time it takes them to go through and double check the codes, make any adjustments, reach out to the providers, all those different steps, it also reduces the time they have to spend on denials because they decrease so significantly. So that accuracy that we worked so hard to have definitely sets us apart from others. Like I said, there's AI everywhere, but our accuracy rate, which is always in the 90s, is not everywhere. We typically see it start at about 50 and stop around 80. But, our owners are software developers. So they believe in constant evolution of a product. And just one piece of that was the AI, and the bigger piece is the accuracy. One thing in a lot of our meetings is, what can we do better? We want to be the very best, but we always want to be better than we currently are. And one example of that, I think, is definitely the accuracy rate that we have for our AI.
Absolutely. And Lauren, I know we just touched on it, but you're our head of development here and you speak with all of our clients. So what's that feedback been like from billing companies after implementing MediMobile into their processes?
I hear a lot of, what am I supposed to do with my extra time? And so in situations like that, we start digging around for, what are the challenges that you previously faced with your last solution or before you had AI? Let's make sure that we're addressing absolutely everything. So once we start receiving the documents, we can start to double down on, okay, what can be improved upon? What do we have to have for the AI? But working with those billing companies that have been working with these customers, whether it be a month or years, we can glean some of that information very quickly from them without even having to bother the providers with it. So that's another reason why these partnerships are so great. We can work together, take all of the information that we have from our different areas of expertise, put it all together, and then we have this package for these organizations and these providers where it's almost like a one-stop shop. I know one of our partners comes to mind, and for that particular organization, when they have a provider that signs up with them, they're signing up to utilize MediMobile along with their billing services, and it's very streamlined. The providers don't have to fill out any paperwork. They don't have to sign a contract with us. It's all going through that billing company. So it makes everything very streamlined.
That's absolutely fantastic. So for anyone listening, where could they get started with beginning this process with us?
So reaching out to anybody on our sales team, going to MediMobile.com, or you can also reach out to your billing company and just tell them that you're interested in utilizing MediMobile. You can feel free to shoot any of us an email and we'll get all the information needed, whether it be to you and your organization or your billing company.
Fantastic. Thank you so much, Lauren. And thank you to everyone for tuning into the MediMobile podcast today. We love sharing how partnerships like this can transform the way medical billing companies work. If you want to learn more about your partnership with MediMobile, reach out anytime again to sales@medimobile.com, our email, or head over to our website, medimobile.com. We'll see you guys on the next episode. Thank you again, Lauren.
Thank you, Emily.